morning. Today we speak about the extensor compartment of the forearm. Boundaries. The skin and the superficial fascia with the deep fascia called as antebrachial fascia, and posteriorly here it is limited by anterior border of the radius and the subcutaneous posterior border of the ulna and the olecranon process. For that you have got to orient it from the medial to lateral. What you see here is the thumb, and once you identify the thumb, you know that that lies on the lateral side, and I identify this bone as the radius on the lateral side. It is limited to the anterior border of the radius, and the ulna on the medial side, where it is limited by the posterior border of the ulna and the olecranon process, and the intraosseous membrane lying in between. The space on the upper part of the intraosseous membrane between the oblique cord of the superior radioulnar joint and the intraosseous membrane, this space allows for passage of the posterior intraosseous artery into this compartment from the anterior aspect. I would like to remind you that the posterior intraosseous artery is a branch of the ulnar artery. The ulnar artery gives off the common intraosseous artery, which divides into the anterior intraosseous and the posterior intraosseous. So, the major vessel which you see here will be the posterior intraosseous artery, and it is through this gap that it reaches this compartment. And all muscles here of this compartment takes origin mostly from the common extensor origin, which is called as the lateral epicondyle. Now we go on to identify the posterior compartment of the forearm. So right now what we have here, I once again identify the thumb to identify the lateral aspect of the specimen. So this goes on to become the medial aspect of the specimen. This is my common extensor origin, which is the lateral epicondyle. The muscles of the posterior compartment of forearm are arranged as two layers. That is, there is a superficial strata and a deep strata. Even in the superficial strata, you see that it has got the arrangement wherein which you have a group of muscles at the back and a few muscles which lie on the lateral aspect. So we first start with the muscles which lie on the lateral aspect. So the first muscle which I would like to identify here is the brachioradialis. The brachioradialis is a lateral muscle seen in the extensor compartment of the forearm. The brachioradialis takes origin from the upper two-thirds of the lateral supracondylar ridge and the lateral intermuscular septum of the arm, and goes downwards and gets inserted into the styloid process of the radius. So it crosses only the elbow joint, and if you reflect it, you can see that under cover of it lies the radial nerve and the radial artery. So the action of the brachioradialis, though it is an extensor compartment of forearm muscle, is that it acts as a flexor of the elbow joint in the mid-prone position. So that is your brachioradialis. Once I have identified the brachioradialis, I again go into the lateral supracondylar ridge. The lower one-third of the lateral supracondylar ridge gives origin to the extensor carpi radialis longus. So this also takes origin from the lateral intermuscular septa, goes downwards, passes along with the extensor carpi radialis brevis. The extensor carpi radialis brevis takes origin from the lateral epicondyle along with the other extensors of the wrist joint. The two pass downwards under cover of the extensor retinaculum. So the extensor retinaculum is a modification of deep fascia which keeps this tendon in position. So these two muscles pass under cover of the extensor retinacula through the second compartment of the extensor retinacula and goes distally. This is the extensor carpi radialis longus and brevis. So these three muscles are called as the lateral group of muscles of the superficial region of the extensor compartment of forearm, of which the brachioradialis acts only on the elbow joint, while the extensor carpi radialis longus and brevis acts on the wrist joint as extensors. It acts synergistically with the extensor carpi ulnaris to extend the wrist, and it acts with the flexi carpi radialis. So you have the flexor on the flexor compartment. When it acts along with the flexor carpi radialis, it causes abduction of the wrist joint. There is a peculiarity regarding the nerve supply of these three muscles. The brachioradialis is supplied by the radial nerve before it divides into its terminal branches in front of the lateral epicondyle. The extensor carpi radialis longus also receives its nerve supply there. So, these two muscles get its nerve supply from the trunk of the radial nerve before it divides into its two branches. The extensor carpi radialis brevis gets its nerve supply from the posterior interosseous nerve. So, these are the three muscles on the lateral aspect. Now, I go on to the muscles which we see on the dorsal aspect. They take common origin from the extensor tendon except for the anconeus muscle here, which is the medial most muscle which you see here. This triangular muscle which is seen here is called as the anconeus. So, now I would look for my extensor digitorum. So, this is the extensor digitorum, this is the extensor digiti minimi. This is the extensor carpi ulnaris, and this is the anconeus which takes origin from the posterior surface of the lateral epicondyle and not from the common extensor origin. So, these are the four muscles which you see on the superficial group. So, the superficial group is composed of 7 muscles from lateral to medial: brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minima, extensor carpi ulnaris and anconeus, of which the extensor digitorum muscle goes on to form 4 tendons which reach over the dorsum of the hand. It reaches over the fingers and then forms an expansion called as the dorsal digital expansion. Over the middle phalanx, it trifurcates and the middle part gets inserted into the base of the middle phalanx, while the rest of it gets inserted into the base of the distal phalanx. As it moves forward, it gives attachment to the proximal and the distal wing tendons. So, what you see here, these are the proximal and distal wing tendons. The proximal wing tendon is formed by the introssi, while the distal wing tendon is formed by the lumbricals. And through this, it acts synergistically with the lumbricals and the introssi, and that causes extension of the interphalangeal joint and the metacarpophalangeal joint. If you look carefully, you can see that these tendons are joined on the medial side. So, the tendon for the index finger from the extensor digitorum is joined on the medial side by the tendon of the extensor indicis, and the tendon for the little finger is joined by the tendon of the extensor digiti minimi. So, these are the tendons of the extensor digitorum. The extensor digitorum is supplied by the deep branch of the radial nerve, which is called as the posterior interosseous nerve. So, this is the extensor carpi ulnaris here. It again gets inserted into the base of the 5th phalanx here and causes conjunction with the extensor carpi radialis longus and brevis. It causes extension of the wrist. It acts along with the flexor carpi ulnaris and causes adduction of the wrist joint. So, that is the action of the extensor carpi ulnaris. On the deeper plane, you see the muscles which are on the upper part. This muscle which you see is called as the supinator. The supinator consists of 2 strata, a superficial strata and a deep strata. The superficial strata gets attached from the lateral epicondyle, while the deep strata gets attached from the supinator crest of the ulna, gets inserted into the radius, and between the 2 strata you have the passage of the deep branch of the radial nerve, which is otherwise called as the posterior interosseous nerve. The posterior interosseous nerve passes between the superficial and deep strata of the supinator, and while passing through it supplies the supinator, and before it passes through it supplies the extensor carpi radialis brevis also. The posterior interosseous nerve descends downwards along with the posterior interosseous artery. It supplies all muscles of the extensor compartment, passes along with the tendons of extensor digitorum and the extensor indicis in the 4th compartment and terminates on the dorsal aspect of the 4th compartment by forming pseudoganglion. The next muscle which you see on the deep strata is the abductor pollicis longus. The abductor pollicis longus takes origin both from the radius and from the ulna and the intervening interosseous membrane, forms the lateral boundary of the anatomical snuff box. So, from below the origin of the abductor pollicis longus on the dorsal surface of the radius, you have the origin of the extensor pollicis brevis. So, this is the extensor pollicis brevis. The abductor pollicis longus extends and abducts the thumb, while the extensor pollicis longus extends the proximal phalanx of the thumb. Now, I go still laterally. I see that the next muscle which you see here is the extensor pollicis longus. The extensor pollicis longus takes origin from the dorsal surface of the ulna below the origin of the abductor pollicis longus. So, this extensor pollicis longus, it gets attached to the distal phalanx of the thumb and extends the distal phalanx. The next muscle which you see here on the deeper plane is the extensor indicis. The extensor indicis tendon joins with the extensor digitorum tendon on its medial aspect as it reaches the index finger and goes on for extension of the index finger. So, this is the extensor indicis. These are the muscles which we see on the deeper plane. So, if I go from here on the deeper plane from lateral to medial above downwards, I have the supinator, the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus and the extensor indicis. As a rule, all muscles here are supplied by the radial nerve, either directly or through its branches. Directly, the radial nerve supplies the brachioradialis, extensor carpi radialis longus. Through its deep branch, it supplies the rest of the muscles except for the anconeus. The anconeus is supplied by the radial nerve in the radial groove. That is about the extensor muscles of the forearm. Thank you.